Hi, I'm Rob Fowler. I'm a critical care and general internal medicine physician at Sunnybrook Hospital. And over the next few minutes, it's my pleasure to walk through our policy at Sunnybrook Hospital that tries to help provide best care for patients, especially at the end of life. We've had certainly a lot of work on end of life and trying to improve our ability to deliver the best care for patients at that very tough point in their life for many, many years. And it's come together as a policy among the physicians and nurses, spiritual leaders, and allied healthcare team over the last few years. At the end of life, having an appropriate care plan and one that respects their wishes and also respects the limitations of some of the treatments that we can provide is really important. We try to base all of our treatment decisions upon what the patient and if they're not able to communicate with us directly, their family members or their substitute decision makers are able to tell us about what they've wanted through their life and what they might want in times like this. And our job is to try to help the families understand what the medical system and nurses and doctors are able to do to help patients ideally get better, ideally get them to a point where they're out of the hospital and feeling good again. But sometimes it's not the case that we're able to cure. It's important for us to balance the aggressiveness that we are technically able to provide, especially in the intensive care unit, with a focus on, again, making sure that patients are comfortable, making sure that they're not suffering with pain or anxiety that sometimes accompanies severe illness, and that we're able to try to keep patients comfortable even if we can't fix them, even if we can't cure them. The ventilator, medications intravenously, dialysis machines, and other things can keep the organs working for a long time. Often we have a hard time, though, getting the whole body better, and it's important for us to try to help both patients and families and understand when we are at the limits of our ability to get people better and are unfortunately in a position where we may only be supporting their organs and really not them as a whole person, and maybe not able to get them back to a quality of life and a state of life that they had hoped for. When patients are inside the hospital and are admitted for an illness, the chances of CPR being effective and getting them to a point where we're able to reverse something imminently reversible unfortunately diminish quite a bit. And I think a lot of us are very much influenced by what we maybe see through television programs where CPR is being used very frequently inside the hospital setting, in the emergency room, or on hospital wards for patients that are quite sick. And it's interesting that on television shows it's almost uniformly effective, and patients frequently leave the hospital smiling and doing very well. In real life inside the hospital, CPR, when someone is very ill to begin with, is often less effective. The notion that CPR will always revive someone, unfortunately, just isn't accurate. And in the process of doing chest compressions and shocks to the heart, for patients that were minimally conscious or regain consciousness for a period of time after that event, it can be a very uncomfortable procedure and often leads them to a condition that was much worse than they were in to begin with. At some point we're all going to go through this period that leads us towards end of life. One of the goals that we might have here, whether it's for a young person, for an older person, for someone that was previously healthy, or someone that has in fact suffered for a long time with a certain medical condition, is to try to get through that phase of life at the end of life as comfortably as possible, applying medical therapies and technologies as much as we can to try to reverse things that we can reverse, and to try to help families and patients through that phase where maybe there aren't any more medical therapies that will cure them, but maybe there are treatments that we can apply that will help keep them comfortable and help provide as good an attempt at a good death as we can.